So I wanted to run you guys through what it's like to have an actual breast reduction / lift consultation, what we discuss, what we do during that time, and sort of what goes into it. So typically patients are coming in and they've been thinking about having this done for a very long time, okay? Typical symptoms are, they have these large pendulous breasts, okay, smaller frames. They have grooves here that you can clearly see in their shoulders, neck and back pain. And these are all questions that I ask you during the consultation. We then go ahead and do measurements, okay? So this is a very important part of the procedure. And the biggest things that we want to know is your sternal notch to nipple distance. And so just like this, we kind of go right there and we look. And this patient is at about 32, okay? Not uncommon at all. And then we also do the other side because we're trying to see how much symmetry. Most, if not all patients have a little bit of breast asymmetry. And if we look at this patient, I would go ahead and guess that this breast might be a little bit larger than this breast. Sometimes the patients do notice it, sometimes the asymmetry is slight, and we talk about those during the process. We also talk about the kind of pedicle we're going to make. And so the blood supply to the breast comes from 4 areas. You have a superior blood vessel, you have a medial blood vessel, you have a lateral blood vessel, and then you have an inferior blood vessel, which comes from the bottom of the breast. There are multiple ways to design a pedicle in order to make sure that the nipple areola complex here survives. I like to do what's called a superior medial pedicle, where this blood supply and that blood supply feeding this area of the breast is preserved. We then essentially raise up this pedicle and we are able to tell the patient where their nipple is going to be. So we place our finger here underneath the breast and we simply mark right there, and that's where she can expect her new nipple areola complex to be, okay? We then go over where the incisions are. So she will have what's known, often referred to as an anchor incision. Well, there will be an incision along underneath the breast here, which is very well hidden because it falls in the inframammary fold. She will have another incision that goes from the nipple areola complex down to the inframammary fold. That incision often heals very nicely, but is the only visible incision that you will see in a breast reduction. And then there'll be another incision around the nipple areola complex here, which hides in that darker skin of the areola, which is also almost imperceptible once the patient is healed. The procedure typically takes about 4 hours. It's done in an outpatient facility. Patients typically never require a drain unless they have much, much larger breasts than she does, but this is very much one of our typical patients. And the satisfaction is at 97% based on multiple studies that have been done, and the relief is instantly felt. This is an incredible procedure for anybody who's a good candidate for it.